I'm Dr. John Stenberg at Zenith Chiropractic in Colorado Springs, and I want to talk to you about how the nerve system impacts the way that hormones are regulated within the body and the structural issues with the spine that could impair neurological performance and as such contribute to hormone imbalances or dysfunction. Many of the vital functions of the body are influenced by the endocrine system. The endocrine system includes all of the glands of the body that secrete hormones to meet the needs of the body. Hormones are chemical signaling molecules that communicate between the brain and the body. So just like a thermostat in a house has a set point, and any deviation away from that set point is how the thermostat knows to crank up or lower the temperature. The hypothalamus, which is a structure in the base of the brain, works like the thermostat of the endocrine system. So that means whenever there's a need on behalf of the body for an increased or a decreased amount of hormones, the thermostat picks up on that need and then sends the signals to the glands of the endocrine system that are located throughout the body to secrete the appropriate amounts at the right times and to stop when it reaches that set point or normal level that it should be circulating in the bloodstream. We use the term neuroendocrine system to describe this function because of the close relationship between the circulating hormones in the bloodstream, the glands that secrete them, and their control by the nervous system. The nervous system is comprised of the brain, the spinal cord, and all the nerves. It's essentially the electrical hardwiring of the body. So the brainstem and the hypothalamus and some of those deep nervous system structures are constantly receiving input from the sensors of the body about changes in its internal and external environment. The job is to then interpret that information and then meet the demands of the body by increasing or decreasing function or supply. So when it comes to the hormone system of the body, there's a very delicate cascade of things that need to occur at the appropriate times and in the appropriate amounts to keep things in balance. That balance is a term we call homeostasis, which essentially just means that your body is functioning in a state of balance the way that it's supposed to. One of those delicate cascades is called the hypothalamic pituitary adrenal axis. It includes a variety of different nerve system structures and glands. So we'll just abbreviate HPA axis to reference that cascade. When the control mechanisms behind the HPA axis become disturbed, then there becomes a inappropriate secretion of hormones either in timing or amount. So what that means is based on the needs of the body, the appropriate amount of hormones are not circulating in the blood. If there's too much hormone, that's a term that is called hyperthyroidism. If there's too little hormone production or release, that's called hypothyroidism. Now those are two different ends of the spectrum when it comes to thyroid dysfunction, but a lot of times there are similar symptoms. So some of the side effects of hormone imbalances include hot flashes, night sweats, temperature regulation problems, weight gain, fatigue, and even some mood changes like depression, mood swings, anxiety, irritability. Those types of things are commonly experienced when the hormone system is out of balance. Most treatments for both hyper and hypothyroidism include taking a drug or a supplement to stimulate or inhibit hormone production. This is a really effective way of infusing circulating hormones into the bloodstream, but if there's a signaling error in the HPA axis or at the thermostat in the brain, that problem is still left unresolved. As the thermostat of the neuroendocrine system, the hypothalamus is constantly processing and integrating countless nerve impulses from different parts of the body. The spinal cord, which is an extension of the brain that travels down through the center of the spine and gives off nerves at each level to supply organs within the body, serves as both the cable that all of those nerves travel back to the brain through, and almost like a switchboard, relaying that information to the appropriate part of the brain to be interpreted. Now, because it's an extension of the brain tissue, it's actually made of similar types of nerve fibers, similar types of nerve cells, is surrounded by the same types of membranes, and is bathed in the same spinal fluid. Now the spine as a whole is made up of 24 individual segments. Those segments move together to produce structural stability in the spine, as well as a great deal of mobility around the foundational center of the body. Now not all areas of the spine are created equal in form and function. The upper portion of the neck, or the portion closest to the brain, is the most movable and as such susceptible to injury. So whether it's a sports injury, slips and falls, things that are jarring to the head and neck, whiplash accidents, things of those nature can produce stresses and strains about the tissues that support the balance of the head and the neck and create a upper cervical subluxation, also known as an atlas displacement. The Still Institute actually published some really interesting research about how this region of the spine contributes to hormone imbalances throughout the body. What their research found is that spinal issues at the C1 and C2 levels, or the top vertebrae in the neck, were found to be contributing to abnormal pituitary gland function. As an important part of that HPA axis, any abnormal function in the pituitary gland is going to disrupt the normal cascade of hormones throughout the body. Neuroendocrine function is a wide-ranging topic. There's a lot of different things that influence that balance within the body, but from a chiropractic perspective, the structural stability of the upper cervical spine, because of its close association with those nerve fibers, with the brainstem, with the fluid that bathes the brain, and the switchboard integration of nerve impulses to and from the body, it's important to consider that a structural injury to that area could be creating neurological irritation that's disrupting or upsetting that cascade or homeostatic balance. In 2016, I had the opportunity to co-author a paper with Dr. John Hilpish. It was a case series that reported on 2 women who suffered with infertility issues. Now, infertility is often categorized as a hormone issue. So with these particular women, they had a significant history of whiplash. They both had car accidents that produced strains and stresses about the upper cervical spine, producing abnormal alignment. The nerve irritation associated with that was causing disruptions in the balance of their hormone system, and as such, they were not able to conceive naturally. Both women went through extensive in vitro fertilization and other fertility treatments with no success. After the nerve irritation and instability in the upper neck was detected and corrected through NeuroStructural Chiropractic procedures, particularly the Blair method of upper cervical chiropractic, the nerve irritation was able to be relieved. The hormone system fell within its normal range of balance again, and both women were able to conceive, go full term in pregnancy, and give birth to healthy babies, which was previously unachievable. So while neuroendocrine dysfunction is obviously a very complex topic, from a chiropractic perspective, it's really important to consider the structural integrity of the spine and the nerve system. So if you are suffering with the negative effects of hormone imbalance and you have not achieved a resolution with conventional treatments, it might be worth exploring the structural aspects of the neuroendocrine system and how structural stress in the spine could be contributing to dysfunction. I always welcome you to a complimentary consultation in the office, which is an opportunity for me to hear your story, to learn about your history, and potentially connect some dots between an overlooked injury and the experience that you're having today.